Okay, guys, so we're going to start with Roman numeral 3, the heart anatomy, and I organized the lecture on how the blood would come into the heart, circulate through the heart, go to the lungs, back to the heart, and then to the body. So the first thing to understand when we look at a heart diagram or a model is that the heart has 4 chambers. The 2 smaller chambers on the superior aspect of the heart are called atria. So there is a right atrium and a left atrium. Then there are 2 larger chambers of the heart. They're called ventricles, the right ventricle and the left ventricle. Remember, we talked about how the right side of the heart, the right atrium and the right ventricle are going to fill with and circulate the deoxygenated blood. And then the left side of the heart will receive and circulate the oxygen-rich or oxygenated blood, okay? So what we're going to do is you're going to be responsible for everything on this diagram, but I'm going to look at, this is our heart model that we would look at in class, and I'll just point at things on the heart model, just, because it's good to look at 2 different things. This is the posterior side of the heart, so you'd want to know everything here as well. This is the posterior side of our model. This is the open, right? We cut through the heart so we can see inside. You need to know everything on this as well. So here is a nice picture because we can see the 2 atria on top. So we have the right atrium and the left atrium, and then the 2 ventricles on the bottom. Let me just mention one thing before I move on. I forgot to mention the word auricle. So the word auricle refers to the flap of tissue that sits on top of the heart. The atrium itself is the space, but on this top we have this flap of tissue. So the auricle, which means like ear. So it's like an ear flap. Okay, so just so that's clear, the auricle is the sort of flap on the superficial aspect of the heart. If we cut the heart open, we'll expose the atrium, right? The atrium is the space. Okay, so looking at this, let's go through our notes. So the right side of the heart deals with deoxygenated blood. So we're talking blue blood. That's why we have blue arrows, because oxygen poor blood is denoted by the color blue. The right atrium is going to receive oxygen poor blood from 4 different blood vessels. The superior vena cava here is going to receive blood from everything above the diaphragm. So all the blood from the chest, the arms, the head, the neck, that's going to drain into eventually the superior vena cava and into the right atrium. Everything from the diaphragm and below is going to come through the inferior vena cava, right? So all the blood returning from your legs, your abdomen, is going to eventually come into this large blood vessel and come into the right atrium. Then we have our coronary sinus. So you can see the opening of it here, the opening of the coronary sinus. That is going to be a blood vessel that's going to drain the blood from the heart itself. Okay, so the heart itself is an organ and it needs a constant blood supply. And so all the blood that's used up, all the oxygen poor blood from the heart itself, will eventually come into, this is a posterior aspect structure. So everything's going to come into the coronary sinus, and the coronary sinus will then lead into the right atrium. Okay, so this is going to take all the blood from the heart itself and put it back into the right atrium. And then, now letter D, we have something called small anterior cardiac veins. I'll show you the picture here. This is one on the heart model. Let me see if it's not pictured here. This is the weird thing. So there should be 1 or 2 blue veins just sitting right here, drawing blood from the right ventricle and putting that used blood into the right atrium. There is a diagram with this further into the notes or further into the PowerPoints. It's just not on this one for some reason. Okay, so we have 4 blood vessels that will take deoxygenated blood and put it into the right atrium. So the blood has coalesced here, right? So now we're going to squeeze that blood into the next chamber, which is the left ventricle. To do that, there's a muscle in the walls of both of our atria called pectinate muscles. So you can see that word here, pectinate muscles. Pectinate muscles look like a basket. They're woven and they're really cool. And this is one of the things that I really don't like about having an online class. One of the things is that you really can't see these real organs because we're not dissecting. But these muscles are really interesting to look at. And they are called pectinate muscles. So they're going to contract and they're going to squeeze the blood into the chamber next door, the right ventricle. So I'll mention the two things here really quickly, but I'll go into them a little bit more later. The sinoatrial node and the atrioventricular node, which actually are not even on this diagram because they're on another diagram. Those are the conduction system of the heart. So those two nodes are important to for the heart to contract. They're located up here. So I'll just point to the general area of the SA node is here. The general area of the AV node is here. Okay, so they're in the right the right atrium. So let's go ahead and move to our right ventricle. We're going to be passing by letter B, an atrioventricular valve. So here it is. This right atrioventricular valve or right AV valve is also called the tricuspid valve. The tricuspid refers to the fact that it has three cusps. It has three flaps of connective tissue. As you see here, the broad area is a cusp, so tricuspid. You can see on the left side, we have a very similar valve, but it's called the bicuspid. It only has two cusps. Another word for it is mitral valve. Okay, so this valve actually has three names. It has the left atrioventricular valve, or you can call it the mitral valve, or you can call it bicuspid valve. I like tricuspid and bicuspid just because it tells me this has three cusps, this has two cusps, and there's a little saying that you can use to remember it. You try before you buy. So you try things on before you buy them. Unless, of course, the internet came along and just ruined that. Now you have to buy it and then you try it. But in the old days, you try before you buy. All right. So let's look at the structures. We have three cusps in the tricuspid. We have something called chordae tendineae. These strings, the elongation fibers of the cusps, are called chordae tendineae or tendinous cords. And they're going to attach the cusps to a specific kind of muscle here called a papillary muscle. So the papillary muscle is this attachment site. This whole structure is necessary in how the valve functions. So let's go into this a little bit. So when the blood is being pushed past the valve passively opens. So the cusps are going to just open up because the force of the blood is running through them. When it's time for, and let me just explain also that when the atria, both atria are going to work together, they're both going to contract at the same time. So when your heart is pumping blood, the top two chambers pump first. They're going to squeeze first. They squeeze the blood down into the inferior chambers, the ventricles. They're going to then relax, and then the ventricles' turn is to contract. Okay, so they're going to alternate contraction and relaxation. So when the ventricles contract, they're going to start to squeeze in, and they want to pump the blood into this little area, which is the pulmonary trunk, through a valve called the pulmonary valve. So what's to stop the blood from going back to where it came from? We want to close off this entranceway into the atrium, right? So that's what the valve is for. The valve is going to close off the sort of passageway back to where it came from. We want to stop that so that we route the blood only one way into the pulmonary trunk. So let's look at the sort of way this works, right? So here is the blood coming through the tricuspid valve, or it could be the bicuspid valve. And then when the ventricles contract, they're going to squeeze that blood. That pressure is going to build up. The way that the valves are made, right, the way they're put together is that they're going to form an umbrella, and so they're going to catch that blood underneath them, but there's a lot of pressure pushing up. But the chordae tendineae, those cords, are going to anchor down to these papillary muscles so that the tips here are going to stay anchored down and shut. So you can put all the pressure you want here on the actual cusps, but you're not going to have these tips kind of evert or fly up because they're anchored down. So that's a element of how these valves work. They have to have their chordae tendineae attached to the papillary valves. If that wasn't present, if you were missing this, then this pressure, these little flaps of tissue would just kind of go way up, right? They would just shoot up and allow the blood to backflow. So you don't want that. Okay, so that's the bicuspid and tricuspid valves work the same way. This is a really cool picture of these valves. So there's the chordae tendineae. This is the papillary muscle. Okay. On the model, just for giggles, right? So here's our cusps, right? This would be the tricuspid valve. This is the bicuspid valve, and then we have the chordae tendineae. And then wherever the chordae tendineae end up, that would be a papillary muscle. All right, let's go back. So we have, so what is the job of valves anywhere, really? Plumbing valves, valves of your body, valves of the heart, is to prevent backflow. So all these valves will close to prevent backflow of the blood so that we can ensure one-way passage through the heart, efficient blood flow. All right, so let's move on to, so we've gone through the tricuspid valve, and then there's a little defect for you, the heart murmur on the side there. So if your heart valves are not working properly, that means that they're letting blood backflow. Maybe it's not all the blood, maybe it's just a little bit of blood that's backflowing to the previous chamber. So that's a murmur. Sometimes murmurs are so small they're undetectable, and sometimes murmurs are a problem, and they need surgery to get fixed. But, you know, there's a degree of severity with heart murmurs. So let's move on to our ventricle. So if we look at our notes under the word ventricle, we have trabecula carne. So that's going to be this, again, a really textured, woven, basket-like appearance of muscle. So that's trabecula carne. So the wall of the muscle is actually pretty textured and interesting. It's not smooth. And then, so in the wall of your ventricles, you have two muscle types, right? You have your papillary muscle that are specialized to attach to the chordae tendineae, and then you also have your trabecula carne. All right, then we have so we talked about 1 and 2. 3, it pumps blood to the lungs via the pulmonary trunk. So the blood's going to get pumped into this feature. This structure is called the pulmonary trunk. Now, you have to say trunk because a trunk is different than an artery. It's different than a vein. It's going to be a common blood vessel before it splits. It's a short blood vessel. It's going to split into either arteries or veins, but that short segment, make sure you put trunk in there. There is a different kind of valve at the base of your pulmonary trunk. This is the pulmonary valve. It's also called the pulmonary semilunar valve because there's 3 half-moon shaped structures or cusps of this. And if you look carefully, there's an aortic valve at the base of the aorta, which you can barely see, but it's the same exact structure as the pulmonary valve. So let's take a look at that closer. Here we can see 2 of the 3 cusps of your pulmonary valve. Let's look at this, right? So when you are pushing the blood through a pulmonary valve, the cusps are very delicate and they're just going to allow the blood to flow through. They're going to be pushed aside. But when the blood settles back down, these are basically the shape of like a cereal bowl, right? They're little bowls and they're going to catch the blood. And there's 3 of them, and when they fill with blood, they're going to completely occlude the blood vessel. So they're going to block the blood vessel so that the blood does not backflow. All right, so it's a very simple mechanism. It's just flaps of connective tissue that are shaped like a little bowl, and when they fill with blood, they completely block the lumen there. So both the pulmonary valve here and the aortic valve at the base of the aorta work the same way. All right, coming back to our image, our diagram. So now the blood is in our pulmonary trunk and we're moving towards the lungs. So the lungs There's two of them, right? There's a right and left lung. So this pulmonary trunk will split into a right and left pulmonary arteries. So remember, we're using the color blue, but it's an artery because the blood is moving away from the heart. So these are the left pulmonary arteries going to the left lung, the right pulmonary arteries going to the right lung. The lungs will oxygenate the blood, bring the blood back to the heart. Okay, there's a pressure switch. I know there's no pump in the lungs, but there's a pressure switch which will force the blood back into the heart. And then here comes the pulmonary veins. So veins are blood vessels that bring blood towards the heart. Here's our left pulmonary veins. There are right pulmonary veins. They're just not seen in this diagram. They're hidden behind this heart, okay? So right and left pulmonary veins come into the left atrium. The left atrium will contract with these pectinate muscles, same muscles, push the blood into the left ventricle through the bicuspid valve. Then the left ventricle will pump the blood into the aorta, and that aorta is going to supply the rest of the body. So it'll branch and branch and branch and branch, and then it'll just go to the rest of the body. Okay, so the aorta is going to be responsible for, it's basically our very first huge artery. All right, so let's see what we covered. So we went through the pulmonary trunk, pulmonary veins, left atrioventricular, ventricle. So letter L, HI, left ventricle. The myocardium is the thickest. It pumps the blood to the rest of the body. So let's take a look at the wall of the heart. So take a look here, right? This is the wall of the right ventricle. Here is the wall of the left ventricle. Look how thick it is in comparison. The interventricular septum, I just want to point out this structure here, which separates the two ventricles. That'll become important in just a second. But just notice how thicker this left ventricle is. Let me show you a real heart. Look at the real heart. So look at the wall here and look at how thick this wall here. So this left ventricle, the myocardium is the thickest. It's the strongest chamber of the heart. And it can generate the most force because it has to push the blood to your big toe, right? It has to push the blood all the way through your body. So this has to generate the most force, and so it's going to be the strongest, most thickest side of your heart, or chamber of your heart. That's the word. Okay. So let's look at the aorta, right? Letter K. So the aorta, let's go back to our diagram, is broken up into three parts. So the ascending aorta is where the blood comes up. The aortic arch arches over the heart. And then the descending aorta goes down behind the heart. So it's invisible here, we can't see it, but if we go to our posterior heart, it's missing here too. We have the arch, but you can imagine how this would come down behind the heart. All right. You can see it on our model, right? This is our descending aorta. Okay, so that's the aorta, and then branches off the aorta. So let's learn these three. There's lots of them, okay? So let's learn these three first. This first branch is called the brachiocephalic trunk. Again, the word trunk because it's going to split immediately. This is going to take the blood to the right side of our body, but brachiocephalic means, brachio means arm, cephalic means head. So the blood here is going to go to our right arm, in our head, the right side of our head. The next one is called the left common carotid. It's going to go up if you remember the carotid canal from the skull, the carotid artery is what goes through that carotid canal, and this is a blood vessel that feeds the brain. So this is eventually going to go into our head and our brain. And then left subclavian. The subclavian artery, this means under the clavicle. So this will go initially under the clavicle and then down the arm. So the left subclavian artery is going to bring blood eventually to our left arm. Okay, so those are the three branches off the aortic arch that you need to know in a diagram like this. I will give you a heads up that the blood vessels chapter 22, you have to learn many, many blood vessels. So I will talk about this again in that chapter. So we'll talk about how this eventually serves the head and the arm, and we'll talk about how these eventually serve the head and the arm. Okay, so branches off the ascending aorta. So So in your notes, letter K, what I did was talked about the second sentence there, branches off the aortic arch. But let's talk about branches off the ascending aorta. This is our first sentence. I'm going to have to find a image. I think it's the first diagram. Sort of. Okay. Let me pause this and find the image. Okay, so this is the image at the end of the chapter, but I'm going to talk about this now. So when the blood is coming into the aorta, right, this initial segment here, so this is the ascending aorta. Now, right off the bat, okay, the organ that gets blood first, the organ that gets dibs on that bright red oxygenated blood is the heart itself. So off the ascending aorta, there's two blood vessels that come right off of that, and that's called the right and left coronary arteries, okay? So this that goes towards the right side, that's called the right coronary artery. It's going to hug a groove between the atrium and the ventricle, and that groove is called the atrioventricular sulcus. So you'll see in the book and in the diagrams that this blood vessel lies in the right atrioventricular sulcus. Okay, so that's going to feed the right side of the heart. And then on the left side, you have a left coronary artery. Same thing, it's in a groove between the atrium and the ventricle, so it's in an atrioventricular sulcus. And it's dotted here because it goes behind the pulmonary trunk. So you see the pulmonary trunk is going to be in front of the left coronary artery. Okay, but the lesson here is basically the heart itself gets its blood immediately from the ascending aorta and those two blood vessels right there. All right, so I'm done with the heart anatomy. So let's just go over a few things here. So hopefully I will point everything out here. So there's fat in the coronary sulcus. Remember that atrioventricular sulcus? So that's also called the coronary sulcus, where your red blood cell, that right coronary artery lies, and vein, and there's fat there. Here's our pulmonary trunk. I'm going to talk about this ligamentum arteriosum in the blood vessels chapter, but this is a remnant of a fetal blood vessel. So, but you need to know this ligamentum arteriosum. Let's take a look at the heart model in class, just for fun, right? So if you guys had this in class, you would say that this is our left auricle, this is our right auricle, this is the left ventricle, this is the right ventricle. You would say this is the pulmonary trunk, right? And you can see it kind of branching there. This is going to be the left pulmonary artery. The left pulmonary artery is beginning there. This big guy, that's your superior vena cava. And this is our inferior vena cava. Okay, so and then we can see what we just talked about. This is the ascending aorta, aortic arch, right? And then we have those three blood vessel initial segments of them. So this is the brachiocephalic trunk. This is the left common carotid, and this is the left subclavian artery. And then we're looking at this red blood vessel that hugs that sulcus. So this is going to be the right coronary artery. And then we can kind of see peeking out here the left coronary artery. The left coronary artery will then branch to go down the front and towards the left of the heart. Remember on the back there was that coronary sinus. This is what the coronary sinus looks like in the heart model. And then we need to know everything here, okay? I said you can see there is a little piece of our descending aorta right here. And when you look at the heart model itself, right, we can see our valves. We can notice how the wall of the model is textured. So that's our trabecular carne. And notice how the wall, when we open up those atria, the wall is also textured. So those are the pectinate muscles of that. Okay, so let's just appreciate the real heart. We can appreciate the real aortic arch. We can look at the three branches here, brachiocephalic trunk, left common carotid, left subclavian artery, our superior vena cava there. Huge papillary muscle. Look at this papillary muscle coming off the left side right there. There's a really big one here. There's a really big one there. The chordae tendineae attaching to those papillary muscles. And then I want to show you one last thing. So this is our section through the heart, and just again to appreciate how the left side is much, much thicker and stronger than the right side, and we can appreciate how odd our textured wall, the trabecular carne of the heart itself is. And we can also appreciate the chordae tendineae with the cusps of our valve. All right, so let's stop here and we'll do heart contraction later.